Welcome everyone. Dr. Mike DeBoard, president of B3 Sciences, excited to share with you the new way to exercise for heart health with BFR and specifically B3 bands. Let's get right into what is the most important thing you can do. Well, the number one killer in the world is heart disease. And people who don't get vigorous exercise are twice as likely to get heart disease. I'm talking about high blood pressure, which leads to ischemic heart disease. Then it can lead to chronic obstructive pulmonary disease and hardening of the arteries and atherosclerosis, and God forbid a clot or a stroke or a heart attack. Look what the American Heart Association says, and pay attention to one word here. 150 minutes of vigorous physical activity per week. They talk about aerobic, and they also talk about strength training. So look at those two pictures to the right, okay? That girl is not going for a walk, okay? This isn't a walk the dog, play a little pickleball, do 20 minutes of yoga. That is not going to cause an adaptive response in your heart. And unless you're lifting heavy weights, you're also not going to create that. Vigorous, which they talk about and Harvard talks about, is not light exercise, which most people do. Now, why is this important? Because as you age and you get into your middle 20s, your natural release of growth hormone is cut in half. So you got all this growth hormone when you're young and everything's fine. We get in our middle 20s, we're getting half the growth hormone. By the time we're in our 40s, we're getting less than 20%. And your metabolism slows down, and then all these things start to happen. If you're in your 30s, 40s, 50s, 60s, you may see it. Early aging signs, body composition changes, arthritis in your joints, cardiovascular disease, cognitive brain degenerative problems, bone density, blood sugar, thyroid. All of these things are happening in people who do not exercise way sooner than they should. You should not see these things, any of these, until you're in your 60s, 70s, and 80s, and then it should be mild forms of these, not things like we have today. What is vigorous exercise? Well, look at those pictures. It's banging the ropes, it's running the stadium stairs, it's CrossFit, it's feeling the burn. Here's what you need to know about exercise and why this is a breakthrough. If you go do any exercise and you don't feel the burn in your muscles, I'm telling you, you're spinning your wheels, because you're not going to produce lactic acid, which is that wonderful burn that's so intoxicating. You get addicted to it, right? That runner's high, that lifting high. But if you don't get the burn for a minimum 4 to 10 minutes, you're not going to change, and you're not going to get any nitric oxide and growth hormone, the two most powerful substances in the world. Let me repeat this. Nitric oxide sitting in your cardiovascular system, growth hormone sitting in your brain, in your pituitary gland, are the two most powerful substances ever. And it cannot be refuted. And they're sitting right in your human body. And look, you know the difference. You know what happens if you walk a couple laps around the track and you go run the stadium stairs. Big difference. You're not going to get lean and mean walking around the track, but you run those stadium stairs and feel the burn, boom. Do a little Zumba class, whole different ball game than banging the ropes in a 45-minute CrossFit class. And heavy weights versus light weights, big difference. Very simple. The people on the left and most people who exercise aren't producing lactic acid. Why? Because it's too hard and it takes too much time and it's high intensity and it hurts and you're sore the next day and you're sweaty, right? And maybe you got to go to a gym and have a trainer, which is all great. Keep doing that. But what if you could do high intensity exercise that was easy, 5-10 minutes, didn't hurt, and elevated your growth hormone and nitric oxide? Well, now you can. And 25,000 people, actually closing in on 25,000 people in the United States, are already doing it thanks to B3. And we have over 20 countries around the world, like Australia and Panama, that are on tonight, that are already doing it. How's it work? You put these bands on your arms and legs. They're this flexible, easy to put on cuff that's patented by B3 Sciences and Be Strong, and you put a little air in it. It's a gentle squeeze. Now, it's not a blood pressure cuff. Doesn't cut off blood flow. It's safe for people who can do regular exercise, and most people can do this. There's very few contraindications. But why does it make it so easy? Because when you put a little air in it, it slows down your blood flow. And I'm going to do a demonstration before we exercise. What does that do? It dramatically reduces how long you have to work out. Imagine 4 minutes quick workout, 20 minutes your longest. 20 minutes your longest workout. Imagine light weights or no weights. Imagine no pain or soreness ever. Imagine that you could do this from anywhere and then elevate two most powerful substances in your body, nitric oxide and growth hormone, which many people, well, actually 95, 98% of people go through their whole life and they waste this. Not only do they not get it, you waste it. It's like leaving money on the table for the maid to come take, right? It's like leaving half your food on your plate. When you don't access these things, you're leaving money on the table for your health. What if you could go for a walk for 10 minutes a day? What if you didn't need 45 minutes of cardio? What if you could go up and down the steps, get on a bike, get on a treadmill, get on an elliptical, go for a swim? Yep, the bands are waterproof. And in 5 minutes, get a workout that would stimulate this change in your body. What if you never had to lift heavy weights? What if you could use light weights or this exercise tubing? We even send you all the resistance you need. And what we're going to do tonight, you don't even need weights. We're going to show you a workout called 4-minute legs. And guess what else we got? We got a 3-minute arms workout. Let me explain this to you. Imagine on Monday you do 4-minute legs. Tuesday you do 3-minute arms. Wednesday you take a break. Thursday you do 4-minute legs. Friday you do 3-minute arms. You take another break. And every 2 out of 3 days you work out for 5, maybe 10 minutes. You don't even change your clothes, and your body changes like you were in the gym for 45 minutes. If you can imagine that, then you now understand why so many people are excited about this. We are the safety company. We pioneered this industry. B3 Sciences, our bands have safety studies showing they do not increase pressure in your cardiovascular system, and they don't reduce oxygen to the heart. And we're the only company that's ever done that. It's because of our patent design. And we're not going to talk about it tonight, but this is why so many NFL teams, Olympic teams, celebrities, famous doctors are using the B3 BFR bands. Now, what happens to your heart when you do vigorous exercise? Well, the first thing that happens is your muscles start running out of oxygen because you're using up oxygen, and you feel a light, wonderful burn in your muscles. And you all know what it feels like. You all know it's good stuff. But inside your body, your cardiovascular system is releasing nitric oxide. It's sitting right in your blood vessels. You don't have to eat beets for this stuff. It's sitting right there, the kind you need. And when you do vigorous exercise or light exercise, like Ocean's doing right there, and you feel the light burn, you get a release of nitric oxide, which immediately thins your blood, reduces blood pressure, dilates the blood vessels, increases blood flow to all of your tissues, and it starts to remodel your blood vessels. Ever heard of a thing called hardening of the arteries? Or venous compliance, where your veins aren't working in your legs and you can't get the blood to come back? Nitric oxide helps those by causing the cardiovascular system to adapt. And here's an actual picture from the study that's posted on our website. Next, growth hormone. Nitric oxide, you get that right when you exercise. But if you continue in the burn for just 3 minutes, I'm going to show you how to do it tonight, where you feel the burn, you just stay in that burn for a few minutes. After exercise, you get a big release of growth hormone. And look what all of our prestigious universities and scientific institutions agree on. Exercise-induced growth hormone can reverse the manifestations of aging by 5 to 15 years. There's no other single therapy currently available that can have the impact on aging and weight loss and bone density and cardiovascular health and thyroid health that growth hormone can have. Look at this study. This is a study on middle-aged men exercising normal, and then putting BFR bands on like B3 bands. 25 times increase in growth hormone. Now, let me put this in perspective for you. Most of you have never seen a growth hormone release like this. Never seen it. Most people go through their whole lives and don't get this. Imagine getting this 4 days a week, 5 days a week, 6, 7 days a week. Growth hormone levels that are typically reserved for bodybuilders, Olympic level athletes. You would start to see major changes. We're going to hear from somebody tonight who's seen that. Let's go back to nitric oxide. In addition to the cardiovascular benefits, you get oxygen everywhere. So this nitric oxide comes and you get that runner's high. You get some endorphins and oxytocin, and it's just intoxicating. You have energy. You do this in the morning for 2 or 3 minutes, and you will blow through your day like you drank 10 cups of coffee. It increases brain power, increases blood flow to organs, and increases performance. And now, what do the studies say? Well, without scientific study, how can anybody say, follow the science? Well, I'm here to tell you, all you've got to do is follow the science on blood flow restriction training. In this study, and by the way, these are all posted on the website for you to review, our findings suggest that BFR training may be effective in lowering blood pressure during exercise. This data has potential application in the management of hypertension and should be further investigated in patients with high blood pressure. So all these people that have high blood pressure are thinking, oh, I can't do this. Well, this study says, yeah, this is exactly what you should be doing, because this is how you strengthen and make your heart younger. How about ischemic heart disease? What's that? That's when the heart can't pump blood and supply its own tissues. So you've got all these arteries going and veins going around your heart to fuel it so it keeps pumping. And people get heart disease, they start to get blockage, and they can't fuel their own heart. This is danger. This study shows that low-intensity BFR training in people with ischemic heart disease resulted in increased muscle strength and mass, as well as endurance or VO2 max improvement. Their aerobic capacity went up. It concludes that BFR is a promising and effective method for cardiac rehabilitation, chronic obstructive pulmonary disease, and muscle loss. This is where the lungs can no longer get enough blood flow due to the damage and the scarring. BFR appears to be a potential management for increasing strength and muscle mass for people who have chronic obstructive pulmonary disease when high-intensity exercise cannot be tolerated. Who can't tolerate high-intensity exercise? 98% of the population. Let's go back. If you could do vigorous high-intensity exercises, you would dramatically, if not eliminate, your chances for heart disease. And one more thing. I had a doctor today in Panama that was so excited. And he said, Dr. Mike, is there anything on venous insufficiency or flow in the legs? I said, you bet there is. Look at this study. Here's the challenge with our veins in our legs, everyone. Most people cannot do vigorous exercise, which maintains what's called venous compliance, the ability for the veins to open and close and the valves to work. In this study of walking, leg venous compliance increased significantly only in the group doing the BFR, which means if you go for a walk, had no effect. Oh, but if you put the bands on and you go for a walk and you feel the burn, you release nitric oxide and growth hormone, and oh boy, are your veins going to change. Well, let's hear from somebody tonight that's had a wonderful improvement in many areas of his life. I'm going to get to Darren Kelsey here and unmute him. Then I'm going to find him here and bring him up. We're going to spotlight him. And Darren, great to have you on our presentation. I know you've had an awesome story, and man, and you got a group going out there that's seeing the similar thing. Share with everybody your story and what happened to you.
Okay, so, well, anybody that's been around might have followed me from a few months back when I first started using the bands, and I started coming out of what they're calling long haulers. So I spent over a year in long haulers, which basically is post-COVID syndrome and causes a lot of inflammation and other problems. And so the bands helped me work my way through that, but I still had a lot of lingering problems. And then over the course of the last number of months, as I've gone and worked with my doctor, I've been wanting to get off of medications. And so I get labs done and we look at them, and there's no need for thyroid medication. There's no need for now blood pressure medication. I was on some depression medication. I don't need depression. I'm off every medication, and I was probably on at least 9 or 10 medications in April. So, and May, part of May. So it's been huge for me. My energy levels went way up. My beautiful wife is as skinny as she's ever been. It's been amazing to watch her and how exciting she is. But her story is even cooler than mine because she's a type 1 diabetic. She was diagnosed when we were 20, or when she was 20. And over the course of 30 years, she's become a type 2 as well. But now with the band use, she's eliminated the type 2 diabetes within her. She's off all type 2 diabetes medications. Her insulin level is a small drip compared to what she's had in the past. And she takes very little, if not any at all, for meals. So she just has a small drip on her pump. And this is somebody that's, had diabetes for 30 years. So I would have thought that was irreversible. And blood pressure for me, I thought would have been irreversible. It seemed to be in my family irreversible once it started. So it's been good news for me, and it's given me a whole second look at things and the way I can exercise and make it manageable.
So Darren, tell them, I mean, obviously you're going to the gym for 2 hours and you got a trainer and you're sweating and you're sore the next day, right? Tell everybody what you actually do, how easy it is with the bands.
All right, I'll tell you. So I think the last time it had me talking, I was just running 10 minutes at the last part of the day just to go around the neighborhood, or not even running, walking, or doing a few sets in the bands, the resistant bands, but not much. But since then, I've gotten kind of serious about things because of how easy and manageable it is. So now I have my home gym all set up, the one I've been carrying around for 30 years and not using. But now I've got it all set up, and I just look at the clock and I go, okay, I got 15 minutes that I'm going to try to get as deep into the burn as I possibly can. And that's what I do every day. So I mix it up. I do different muscles. I don't even have a serious plan, but I try to work all my muscles over the course of a couple weeks.
Awesome. Well, we appreciate that, Darren. And real quick, you're seeing the same thing in a lot of these clients. I know you're doing something cool. You've got close to 35, 40 people you've now scanned and got on regular programs. What are you seeing with them?
So what we're doing now is we're trying to make sure everybody understands how to use the bands, because that seems to be the biggest problem. You kind of get veered off, you get sidetracked. The biggest problem I see is our past understanding of exercise. It gets in the way. So we're trying to help people see it from a different direction by the chemistry and just trying to help them see that you can get into that deep burn without spending all that time.
Awesome. Well, Darren, great story. Appreciate you being on. You're an inspiration to everybody, and super excited what you got going on out there in St. George. Thanks for being here.
Thanks for having me.